Hello, my name is Brooke. I'm going to be your student nurse today. Can I get your name and date of birth?
Yes, my name is Lindsay and I was born on October 18th, 2001.
Okay, and do you know where we're currently located?
Yes, Saginaw, Michigan.
And what the year is?
2021.
Perfect. She's A&O times 3. I do have a few health history questions for you. Have you had any recent surgeries or medical diagnoses that we should be aware of?
No.
Perfect. Are you on any medications currently?
Just birth control.
And any issues with that?
No.
Okay. And then I do have to ask you a few questions related to drinking and drugs. I just ask that you give the honest answer. We're not going to report you or anything, but we need to know. So, do you use any street drugs?
No.
And do you smoke at all?
No.
Okay. And then do you drink alcohol?
Every once in a while.
Okay. And then about how often would you say?
Maybe twice a week.
What kind of alcohol do you drink?
Usually liquor.
Okay. And then how much per night?
Maybe a glass or two.
Okay. All right. I believe that is all for the questions. I'm going to get some vital signs on you. Do you have a preference for arm for blood pressure?
My left is fine.
Okay. Okay. Okay, that was 117/76. Is that pretty normal for you?
Yeah.
All right. And then I am going to check your pulse on your wrist really quick. Okay. Okay, your pulse was 69 beats per minute, and then your respirations were 18. We don't have a thermometer, otherwise I would check temperature, and I also don't have an O2 monitor, so we would also do that at this time. For beginning for your assessment, I'm going to look at your arms and your hands, just looking at skin integrity. Everything looks good. And then, have you ever had any issues with your tattoo on your arm? Okay. And then, can I have you squeeze my fingers really quick? Perfect. And then you have nail polish on, so I'm going to check cap refill, which looks good. And then, if I could have you, do you know how to swim?
Yes,
Okay.
I do.
So I'll have you do with each arm one movement forward and one movement backward, like front stroke and back stroke, and then I'm going to place my arm on your shoulder to check range of motion and look for any clicking or issues with movement. Okay, feels good. And then this arm. Okay, perfect. And then same thing, I'm going to have you bend your elbows and just feel your joint there. And then straighten it back out. And then same thing on this side. Okay, perfect. Next I'm going to check your cerebellar function. So if I could have you put your fingers like this and then go down and then just keep doing that as fast as you can, back and forth. Yep. And then the second test is if you put your hands on your lap and then flip your hands over and then just go like this as fast as you can. Okay, great. And now I'm going to start assessment on your head. So, have you ever had any concussions or anything? Any tenderness? Okay, I'll feel back of your head looking for symmetry. Have you had any major hair loss recently?
No.
Okay, everything looks symmetrical. So now I'm going to do lymph nodes. I'm going to start on the back of your head and then work forward. So we have occipital, feel post-auricular, pre-auricular, submandibular, submental, cervical chain. And then if I could have you shrug your shoulders, and then supraclavicular. All of hers are non-palpable. And then if you don't mind, I'm going to check on your clavicle, your tissue turgor. So I'm going to pull this down a little bit. And everything looks good there. No tenting. And then I'm going to push down on your shoulders really quick and have you push up. And that's testing cranial nerve number 11, which is your spinal accessory nerve. And then same thing with resistance. I'm going to have you push with your arms against mine. So first I'm going to push out, or you can push out, I'll push in, and then the other way. And then push down, and then the other way. Okay, perfect. All right, so now I'm going to look at your ears, looking for symmetry. And then have you ever had any issues with your piercing?
No.
Okay, perfect. Everything looks good there. I'm going to check your sinuses. So we have frontal sinus. Any pressure there?
No.
And your maxillary sinuses, which also feel good. Any pain or pressure there?
No.
Okay. All right. And then I'm going to move on to your eyes. So first thing I'm going to do is look in your pupils. And then I will do a what is called the cardinal field of gaze. So I will have you follow my pen, and then I will check your corneal reflex as well. So, okay. Pupils reacted well, and they are round, so that's good. Second thing I'm gonna have you do is follow this with your eyes, and do not move your head with your eyes. Okay. Okay, good job. That is cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. And then the last thing I'm going to have you do for your eyes is look at this, and then for 10 seconds, and then when I tell you to switch, I'm going to have you look at the calendar on the wall. I'm looking for accommodation in your eyes, so I'll tell you when to change your direction of vision. Okay, you can look over there. And then back at the pen. Perfect. Okay, so her eyes were perla, which means her pupils are equal in size, they're round, reactive to light, and they accommodate. Those are all good things. The second thing I'm going to look at is your nose. So I'm going to push up on your nose a little bit, give you a pig nose, and look inside. Have you ever broken your nose?
Mm-mm.
Okay. There's no septum deviation, which is good. And then if I could have you close your eyes, I'm going to place an object under your nose, and if you can smell it, just let me know what you smell. If not, I don't know. Okay, so here we go.
Yeah.
What do you smell?
Coffee.
Okay, that's testing cranial nerve number 1, which is the olfactory nerve. Everything looks good there. We already checked your sinuses. So now I'm going to look in your mouth. So first, can I have you stick your tongue out? And then I'll have you make a happy face, a sad face, and an angry face. Great job. That's cranial nerve number 7. Testing the facial nerve. So those are all the facial expressions. Can I have you stick your tongue straight out and then open your mouth and say ah? Okay. So that's cranial nerves 9, 10, and 12, which are glossopharyngeal, vagus, and hypoglossal. And then if you could open your mouth again, I'm going to look at hard palate, soft palate, both cheeks, And then, do you have all of your original teeth?
Yes.
All right. And then, have you ever had wisdom teeth removed?
No.
All right. Perfect. I'm gonna look at my sheet. Okay, the last thing I'm going to check from your arms are your radial and brachial pulses to make sure that they're symmetrical. So if I could just have you put your arms out like that. Okay, then I'll go up here. Okay, great. Next, I'm going to palpate your carotid arteries, and then I will also listen to them for any bruits. So, okay. Pulse is strong on both sides, so that's good. And then I'm gonna listen. Okay. Everything sounds normal there. Now, if you don't mind, if I could have you take off your shirt, I'm gonna listen to some lung sounds on the back side. So first, gonna look for symmetry. Do you have any moles that you're worried about?
No.
Okay. And everything looks symmetrical, skin looks good. And I'm gonna place my hands back here and have you take a deep breath. Okay. So just looking for equal expansion. And then I'm gonna check for barrel chestedness. So we want a 2-to-1 ratio, which it looks like you should be good. Do front to back, so this should be twice as wide as this is, and not a 1-to-1 ratio. Next, I'm going to percuss your lung sounds, and then I will listen, or I will auscultate them after. So I'll start up here. And then I'm gonna move your bra up a little bit so I can get underneath. And then we're looking for resonance there is the sound, which yours sounded good. And now I'm going to listen to them. I'll have you just take some deep breaths as I go down, and then I'll tell you when to breathe in and out as I listen to each side. Okay, so in and out, in and out, in and out. Okay, everything sounds clear. There's no whooshing or crackling in your breath, so that's all good. I'm gonna have you lay down next, if you could. And then have the patient lay flat, and I'm gonna have you turn your head that way for a second. We're looking for any JVD, so jugular vein distension on both sides. There's none present, and then I'll have you turn your head towards me, and everything looks good on that side as well. So I will give you a pillow now for your head. Okay? If that were to be present, we would want it to go away at 45 degrees. So first thing I'm gonna do is listen to your heart sounds. I'll listen with both sides of my stethoscope. With the diaphragm, we're listening. It's for things that we want to hear, so I should hear a normal like lub dub sound. And then when I listen with the bell, I'll be listening for any heart murmurs. So the first is at the second intercostal on the left side of the sternum. This is the aortic. Okay, and then second intercostal on the left side is the pulmonic valve. And then third intercostal space, sorry,
It's okay.
is Erb's point. Okay, and then fourth intercostal space, if I could have you actually do it, thank you. This is the tricuspid valve. And then the last spot is your mitral valve, which is fifth intercostal and is over to the side. I'm going to take your apical pulse here for a minute. Okay, and your pulse there was 72. So now I'm going to go back through and listen to each one with the other side of my stethoscope, listening for any heart murmurs. So back to the aortic, pulmonic, Erb's point, and then if you could lift your breasts up, tricuspid. Sorry, my hands are cold.
That's all right.
And then mitral again. Just okay, everything sounds good. Next thing I'm going to do is inspect your abdomen. So, what's that over there for now? Looking for symmetry, any bulges or sinking in the abdomen. Everything looks good on her. So, next thing I'm going to do is listen for bowel sounds. And then I will go into arteries in your abdomen as well. So I'll name them as I go through them. So first listen for vowel sounds. Could you, like, pull your shorts down a little bit so I can, yeah. Okay. Okay. So listening for vowel sounds starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Okay. We're listening for gurgling sounds there, so about 5 gurgles at each spot. Next, I'm going to listen to your arteries in your abdomen, starting with the aortic, and I'm going to use the bell side for this because we're listening for any bruits, just like in the carotid. So this is your aortic, and then renal, then other renal, and then iliac, okay, and then I have to find your femoral pulses, so see if I can find it. Okay, now do you mind lifting your short leg up a little so I can listen? Okay. Okay, and then same thing on the other side. This one could be ticklish, I'm sorry. Okay, everything sounds good. The next thing that I have to do is percuss your abdomen. So I'm gonna, like I did on your lungs, I'm gonna do that in a few spots in each quadrant, looking for a timpani sound, and then I will also go up by your liver and look for a dull sound. So sorry, this tickles, I know. Okay, those all sound good. And then find your liver border by your rib cage. So that sounds more dull than the other areas, which is what we want. And then the next thing will be light palpation. So I'm just gonna feel on your stomach, not press very hard, but we're looking for any masses or bulging or anything on the inside. And just let me know if anything hurts. Okay, and then deep palpation, so I'm just gonna push harder and use more circular motions for this. Again, let me know if anything hurts. Okay, everything feels good. Now I'm gonna move down to your legs. And first thing I'm going to do is just look at your skin. Looks like you have a scar here. Have you had any issues with that?
No.
Okay. Besides that, skin is cool to the touch. Skin tone is even, and muscle mass is even as well. For now, I'll let you leave your socks on, but I'm gonna need to take those off later.
Okay.
Okay. I'm already checked her femoral pulses, so I'm gonna check the popliteal on both sides. Okay, and then the posterior tibialis on both sides. Okay, and then dorsalis pedis on top of the foot. Okay, those are all good. The next thing I'm gonna do is I'm gonna touch you either right knee, left shin, right shin. I'm gonna have you take your socks off for this. The top of your feet and the bottom of your feet, and I'm gonna ask you where I'm touching, and then if it's sharp or dull. So I'll give you like a reference first. So this is dull, and then this is sharp. Can you tell the difference?
Not really.
So can you tell the difference between that and that?
No.
Oh no.
My knees get numb in some areas.
How about up here? That?
Yes, that.
That? Okay,
yeah.
So I'll go more towards the top of your knees, and then I'll make sure that you can feel the difference here.
Okay.
Can you feel the difference?
Yes.
Okay, and then feet?
Yes.
Okay, perfect. So I'll go a little more on top of your knee. Okay, so just close your eyes and then tell me what you feel.
Sharp in the right knee area. Dull in the left area. Dull on my left foot.
Top or bottom?
What do you mean by that?
Like, this is top of your foot, this is bottom of your
top.
foot. Okay, and then
sharp on my right shin. Sharp on my left. Dull on my right top of the foot. Dull on my right bottom of the foot. Dull on the left bottom of my foot.
Okay, she got an 8 out of 8, which is good. And then it's important to remember to always use dull on the bottoms of your feet when you're testing that stuff. I'm going to check my paper again to make sure I didn't miss anything. Okay, the next thing I'm going to have you do is sit up, and if you would like to put your shirt and socks and shoes on, or we'll put your shoes on in a minute. You can put your socks on for now. So just like I checked with your arms, I'm going to check range of motion with your lower body as well. So I'll have you resist, and then I'll also check your patellar reflexes once you're dressed. Okay, so can I have you swing your ankles like in a circular motion, move your toes around? Perfect. And then I'll have you push out against my arms and then pull in against my arms. Okay, perfect. And then if I could have you scooch to the edge of the bed. I'm gonna check your reflexes. Doesn't matter, just so I can test your reflexes. Okay, no, don't rest your feet. Okay, so check your left. Okay, there we go. Third tries the charm. Okay, and then same thing over here. Okay, that one moved pretty good. Alright, next thing I'm going to have you do is put your shoes on.
Do I still need to be on the bed for this?
Yeah, kind of. Do you need any help with that?
No.
Okay. Please don't fail me. Okay, now you can stand up, And come down the stairs. And I'm going to have you stand feet shoulder width apart, and have you close your eyes. Doing the Romberg test, which is testing the acoustic nerve, which is number 8. She has a negative test, which is good, so no swaying. And then now I'm going to have you walk towards the window, just normally. And then turn around, and on your way back, I'll have you do heel to toe walking. Okay, looks good. And then if you can sit back on the bed, I just have 2 last questions about diet and exercise. So would you say that you eat a fairly balanced diet? Do you eat out a lot?
I'd say a more balanced diet.
Okay. And then how about exercise? How many days a week?
Maybe twice.
Okay. And then is that moderate, intense exercise?
Kind of just moderate, just walking.
Okay. All right. And then after assessing skin integrity and asking those questions, I would give her a 23 on the Braden scale for no risk of any skin, like pressure ulcers or skin integrity issues. I believe that is all. Do you have any questions for me?
No.
All right. Thank you.